The MedStar Health Center for Diagnostic Systems Safety is our new center focused on diagnostic safety and thinking about lots of ways that we can improve diagnostic excellence. When you think about it, the entry point for everyone is diagnosis, right? So it's rare that someone's never had a diagnosis, whether it's a cold or sprained ankle. It's almost always the entry point into the healthcare system. We think about diagnosis being really the starting point of care, and we need to get that right. So the implications are big and broad, and for us that gives us lots of opportunities on the research side, but also to improve clinical operations and education as well.
MedStar Health's work in diagnostic safety is truly innovative and novel. Many diagnostic researchers focus just on the provider side, and our take is that we have to understand all voices here to really get diagnostic safety right. We take a systems-based approach, meaning we look at all the different tools, technologies, and processes that impact diagnostic accuracy. So instead of just focusing on the provider or just on a piece of technology like the electronic health record and how that might shape a clinician's decision, we focus on all those different systems and how they work together to get diagnostic accuracy right.
We can test anything, and we have a health system that has said priority number one is quality of care we deliver and safety to our patients. You put those two things together and you have a really powerful place to test the most innovative approaches in quality and safety and health equity that you can find anywhere.
I think our most successful implementation of a solution is in the cardiovascular space. So we have patients that are presenting with some sort of cardiovascular risk, risk of heart attack, heart disease, stroke. And that risk often goes unnoticed, but when you look at objective data, vital signs, diagnoses, medications, we can quantify the risk and convey that to the patient. So we launched a cardiovascular risk calculator into the electronic health record at MedStar. It has fired over 2 million times, and we're communicating that risk to patients. So something might happen to you in the next few years, and there's things that we can do about it. So let's think about modifiable risk behaviors. Can we improve exercise? Can we improve diet? Can we reduce your stress? Can we improve your sleep? There's a number of things that we can talk to patients about. If they're aware of their risk, if the clinicians are aware of their risk, then we can actually work to improve their health.
MedStar Health is so committed to highest quality and safety, and we innovate as much as we can in that area. Yet sometimes it takes that extra push and that extra little bit of magic to help us get there, to have people to be able to focus on that innovation, and that's where we really benefit from partners.
I think for any of the work that we're doing, whether it's patient safety, diagnostic safety, training, clinicians, scientists, policy experts, there's a need for funding to support the investigators. So philanthropy, I think, offers an opportunity to support us financially, but even bigger than that, to build our brand, to make people aware of the work that we're doing. We want to build those community partnerships, especially for the work that we're doing, patient engagement, family engagement. It's not just about the patients that are already in the system, it's bigger than that, who are the folks in the community that we can reach that might also be interested in our work. Diagnostic safety, it's how we treat people.